Hello, my name is Erin Adams, and I will be presenting my World AIDS Day project for HSC 4593, and my country is India. India is located in southern Asia, bordering the Arabian Sea and the Bay of Bengal, and it's also located between Burma and Pakistan. India gained its independence from Britain on August 15, 1947. It is a federal parliamentary republic. New Delhi is the capital of India. As of July 2015, India's population was 1,251,695,584. 51.9% of the population are male, 48.1% are female. The population age structure of India is as follows. 28.09% are between the ages of 0 and 14. 18.06% are between the ages of 15 and 24. The largest age group, comprising of 40.74% of the population, are between the ages of 25 and 54. 7.16% are between the ages of 55 and 64 years of age. 5.95% are 65 and over. The life expectancy at birth for total population is an average of 68.13 years of age. Males, 66.97 years of age. Females, 69.42 years of age. India's labor force is comprised of 502.1 million people. 54.4% in services, 29.5% are in industry, 16.1% are in agriculture. India has the third largest HIV epidemic in the world. Don't be fooled by the prevalence rate of only 0.3%. This is a result of India's massive population. In 2015, India had 2.1 million people living with HIV, 130,000 AIDS-related deaths, and 86,000 new HIV infections. The major modes of transmission are male-to-male sexual contact. Of the 427,000 MSM, 4% are infected. Injecting drug users. Of the 177,000 people who injected drugs, 7% are infected. Mother-to-baby transmission. Of the 35,000 HIV-positive pregnant women in 2013, 13,000 babies were born infected. Specific groups that are most affected are sex workers. Sex work is not strictly illegal in India. One study found that the HIV prevalence among sex workers averaged 14.5% among districts in 4 southern Indian states. Male sex workers are extremely vulnerable, an HIV prevalence of 33% among this group. Gay men. Stigma and discrimination are barriers that make this group hard to reach with HIV prevention and treatment. Hijras. are names given to transgender persons in South Asia. In 2012, the National AIDS Control Program collected data about HJRAs separately and found that 8.8% were living with HIV. Injected drug users. HIV prevalence among females of this group is twice higher than that of males. The relationship between sex work and drug use accounting for the difference. Migrant workers. 7.2 million migrant workers are in India. 1% are living with HIV, much higher than national prevalence of 0.3%. 75% of women testing positive in India have a husband who is a migrant laborer. Migrant workers also have been found to have a low-risk perception of HIV transmission. Truck drivers. 2.6% of the 2 million truck drivers are living with HIV. This group is thought to have a high vulnerability to HIV transmission because many engage in high-risk behaviors, like paying for sex. They are a bridge population, transmitting HIV to their regular sexual partners and then into the general population. In India, antiretroviral therapy has been available for its population for free since 2004. However, of the 2.1 million HIV infected, 1.1 million do not receive the treatment they need. Only 36% of children and 43% of adults HIV positive received antiretroviral therapy. There are 455 antiretroviral centers nationwide, one ART center for every 4,552 HIV patients. Stigma and discrimination deters specific groups from getting treated. India has the third largest HIV epidemic in the world. 2.1 million are living with HIV. People living with HIV in India face stigma and discrimination. The key affected groups are sex workers, gay men, and HJRAs. Negative behaviors among healthcare staff deter these groups from disclosing their status and getting the free available treatment. We must act now to help prevent this social stigma and discrimination of these groups. We need management programs in place to help sensitize health workers and establish policies to prevent social stigma. Every human being deserves to be who they are and not risk their health for fear of discrimination. All of India's citizens deserve access to the free ART therapy. Previously, India relied on international funding sources, but in 2012, India committed to financing 90% of its HIV/AIDS programs. 67% of the budget is spent on HIV prevention, and 17% is spent on treatment, care, and support. Some of these HIV programs are as follows. Project Paychan provides easy access to HIV and sexual health services for men who have sex with men and transgender. Avahan works to reduce transmission among sex workers with education, condom promotion, STI management, and behavior change communication. The Sanaguchi Project promotes the use of healthcare services for sex workers, education, condom distribution, and promotes behavior change and refers sex workers to health clinics. Project Havoc works to stop the spread of HIV among truckers, encouraging behavior change, condom promotion, health services, and HIV testing and counseling. Harm Reduction, aimed at injecting drug users, provides needle and syringe programs, opioid substitution therapy, and peer education, prevention of parent-to-child transmission of HIV/AIDS program, aims to initiate antiretroviral medications to pregnant and breastfeeding women living with HIV. Link Worker Scheme provides HIV resources and education, condom distribution, and referral for treatment in hard-to-reach rural communities. Red Ribbon Express, run by Indian Railways, is an HIV and AIDS awareness campaign train that travels to rural parts of India. It provides education, HIV testing, and counseling. The Condom Social Marketing Program distributes over 560 million condoms across 15 states in India. The HIV/AIDS bill submitted in 2006 was passed in 2014 in India. It prohibits the discrimination in employment, education, health care, travel and insurance, and calls for a legal commitment by the government to provide free HIV treatment. It also maintains that a person living with HIV has the right to privacy and confidentiality. India has made great strides in prevention, education, and the treatment of HIV/AIDS in their country. I am hopeful that India will continue their forward progress. This concludes my presentation of India. Thank you very much.